Calcitriol, uses, benefits, side effects, and more. Calcitriol is the active form of vitamin D3 essential for maintaining healthy calcium and phosphate levels in the body. It plays a key role in bone health and is vital for patients with kidney disorders or low calcium levels. This medication is commonly used to treat conditions like chronic kidney disease-related bone disorders, hypocalcemia, and certain types of rickets. Calcitriol helps the body absorb calcium from the diet and reduces calcium loss through urine. It also regulates parathyroid hormone, PTH, levels, making it effective for managing secondary hyperparathyroidism. Available in capsules, drops, and ointment forms, it provides targeted relief and support. Its benefits are particularly significant in patients who cannot convert vitamin D into its active form naturally. What is calcitriol? Calcitriol is the active form of vitamin D3, also known as 1,25-dihydroxycholecalciferol. Unlike cholecalciferol, which requires conversion in the liver and kidneys, calcitriol is already in its biologically active state. It plays a crucial role in calcium metabolism and bone health. Calcitriol tablets and calcitriol capsules are commonly prescribed to patients with kidney problems or parathyroid gland disorders, especially when the body cannot convert regular vitamin D into its active form. This makes calcitriol vitamin D essential in certain medical conditions. What are the benefits and uses of calcitriol? Calcitriol helps regulate calcium and phosphate levels in the body, promoting healthy bone formation. It is commonly used to treat conditions like osteoporosis, hypocalcemia, and kidney-related mineral imbalances. Calcitriol uses: treats low calcium levels in patients with chronic kidney disease, especially those on dialysis. Manages hypoparathyroidism, a condition where the parathyroid glands produce insufficient hormone. Helps control calcium and phosphorus levels in the blood. Prevents bone diseases such as osteomalacia and rickets. Conditions calcitriol treats: secondary hyperparathyroidism in dialysis patients, renal osteodystrophy, hypocalcemia due to hypoparathyroidism or pseudohyparathyroidism. Secondary uses of calcitriol: sometimes used off-label in managing osteoporosis, vitamin D-resistant rickets, or psoriasis, in topical form such as calcitriol ointment. How does calcitriol work? Calcitriol functions by increasing calcium absorption from the intestines, reducing calcium excretion through the kidneys, and mobilizing calcium from bones when needed. Unlike cholecalciferol, which must be metabolized into its active form, calcitriol directly interacts with vitamin D receptors in various tissues, particularly in the bones, kidneys, and intestines. It also regulates parathyroid hormone, PTH, secretion, helping prevent calcium and phosphate imbalances. If you're comparing cholecalciferol versus calcitriol, the key difference is that calcitriol is used when the body cannot activate vitamin D naturally. Calcitriol dose and how to take it. Calcitriol dose varies based on the condition but is usually taken orally once or twice daily as prescribed by your doctor. Always follow your healthcare provider's instructions and take it with food to improve absorption. Typical calcitriol dosage. Dialysis patients start with 0.25 micrograms daily, may increase by 0.25 micrograms every 4 to 8 weeks. Hypoparathyroidism, usually 0.25 to 2 micrograms per day, depending on severity. Psoriasis or skin issues, use as calcitriol ointment as directed by a dermatologist. How to use calcitriol tablets or capsules. Take calcitriol tablets or calcitriol capsules by mouth once daily, with or without food. For best results, take it at the same time each day. If using liquid form, use a proper measuring device. Missed dose of calcitriol? If you forget a dose, take it as soon as you remember. If it's almost time for the next dose, skip the missed one. Do not double your dose. What happens in case of calcitriol overdose? An overdose of calcitriol can lead to dangerously high calcium levels in the blood. This may result in serious health issues if not treated promptly. Symptoms of overdose: nausea or vomiting, loss of appetite, weakness or fatigue, abdominal pain, constipation or diarrhea, irregular heartbeat or kidney issues. Seek emergency medical help if you suspect an overdose. What to avoid while taking calcitriol? Avoid calcium-rich antacids or supplements unless prescribed. Do not combine with other vitamin D products. Limit sun exposure if using calcitriol ointment for skin conditions. What are the side effects of calcitriol? Like any medication, calcitriol capsules can cause side effects, although not everyone experiences them. These may vary depending on dosage, medical condition, and individual sensitivity. Common side effects: headache, nausea, muscle or bone pain, dry mouth, metallic taste, fever, constipation or upset stomach. Serious but rare side effects: hallucinations, vision changes, irregular heartbeat, painful urination, rash, hives, or itching, yellowing of the skin, jaundice, elevated blood calcium levels. Consult your doctor if symptoms are severe or persist. Precautions and warnings. Before taking calcitriol capsules or calcitriol tablets, it's important to understand the potential risks and take necessary precautions to avoid complications. Always take calcitriol under medical supervision, especially if you have existing health conditions or are on other medications. Who should avoid calcitriol? Pregnant or breastfeeding women, use only if clearly needed. Children, unless prescribed specifically. Patients with hypercalcemia or known sensitivity to vitamin D products. Use with caution if you have kidney stones, liver problems, allergies to other forms of vitamin D. Are there any age restrictions for calcitriol? Calcitriol can be used in all age groups under medical supervision, but dosage adjustments are necessary, especially in children and the elderly. Alcohol or food interactions. Excessive calcium or vitamin D in the diet may amplify side effects. Take with or without food, but maintain consistency. Avoid alcohol if it worsens your medical condition. Possible drug interactions with calcitriol. Taking calcitriol tablets or calcitriol capsules alongside other medications can sometimes cause adverse effects or reduce the effectiveness of either drug. It's essential to be aware of potential interactions and to consult your doctor or pharmacist before combining treatments. Major drug interactions. These medications may significantly alter the effects of calcitriol or increase the risk of serious side effects. Idelalisib may elevate calcium levels, leading to complications when taken with calcitriol. Ivacaftor may interfere with vitamin D metabolism, affecting calcitriol efficacy. Moderate drug interactions. These drugs may require dose adjustments or additional monitoring when used with calcitriol. If ever ends, may reduce vitamin D levels, potentially affecting calcitriol and its effectiveness. Elvategravir can alter vitamin D metabolism and calcium balance. Axitinib may interact with the body's ability to regulate calcium. Linagliptin may increase sensitivity to calcitriol or vitamin D analogs. Mitotane can interfere with vitamin D metabolism, reducing calcitriol's action. Dabrafenib may reduce plasma levels of calcitriol through enzyme induction. Always inform your doctor or healthcare provider about all the prescription medications, over-the-counter drugs, vitamins, herbal products, and dietary supplements you are taking. This helps prevent unwanted drug interactions and ensures your treatment plan is safe and effective. How should calcitriol be stored? To ensure the medication remains effective, it is important to store calcitriol properly. Keep it in a cool, dry place, away from direct sunlight and moisture. Make sure the container is tightly closed when not in use. Additionally, ensure that it is kept out of reach of children. Storage guidelines. Store at room temperature, 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. Keep away from heat, moisture, and direct sunlight. Do not freeze. If not stored properly, exposure to heat, moisture, or air may reduce the effectiveness of calcitriol capsules or tablets. Always keep it tightly sealed and out of reach of children and pets.